Pernicious anemia is more common in people of Northern European and African descent. Other risk factors is due to the lack of intrinsic factor, which prevents the intestine from absorbing vitamin B12. When a person has type 1 diabetes, different organs of the body are affected, especially the kidneys. Erythropoietin is a hormone required for the red blood cell production. When kidneys are damaged, especially in case of most diabetic patients, they make less and less erythropoietin, which predisposes them for anemia. When patients have Crohn's disease, they have inflammation and diarrhea, which affects the absorption of vitamins and minerals, which can predispose them to pernicious anemia. Meat and animal products are the only source of vitamin B12, and someone who is vegetarian will have limited supply of vitamin B12 and iron. Genetics play a role in predisposing someone to Crohn's disease. Some people are born with not enough intrinsic factor and can predispose someone to pernicious anemia. Surgery, of course, because when part of the stomach is surgically removed, then together the part where parietal cells is located is removed too. The clinician should be able to differentiate pernicious anemia with other conditions that affect absorption of vitamin B12, so restoration of health can be started as soon as possible. Some differential diagnoses for pernicious anemia are malnutrition, gastric cancer, celiac disease, irritable bowel syndrome, bariatric surgery, Fckdksn7, iatrogenic medication that blocks gastric acid production, such as H2 antagonists like cimetidine, Pepcid, and Zantac, gastric outlet obstruction, Zollinger-Ellison syndrome, folic acid deficiency, and myelodysplastic syndrome are also some of the differential diagnoses associated with pernicious anemia.